Welcome back to the Global Goals Studio. Mark Suzman, when we look just in the United States about the equitable distribution of vaccines, there are sharp racial disparities. The percentage of African Americans vaccinated in many states is far below their share of the general population and even below their share of sectors such as healthcare workers. So my question is, if we're struggling to achieve health equity with a vaccine in the largest economy on the planet, how on earth are we going to achieve health equity across the globe?
Well, the short answer is currently we are absolutely failing on that. That although there were lots of grand sentiments last year when we launched the COVAX initiative, which was intended to be a multilateral initiative for rich and poor countries alike, to pool resources and make sure we get equitable access to vaccines when they get regulatory approval. And there was agreement that we should prioritize healthcare workers and the neediest across the world before we start going into other groups. That is simply not happening. Both between rich and poor countries, rich countries have taken orders of bilateral orders, many times exceeding their population, at a time when in Africa, there have been barely a few dozen vaccines administered to date across the entire continent. And then within countries, as you say, despite all the now well-known data about inequities in the incidence of COVID and the impact of COVID on racial minority groups, on other communities like Eddie's communities with disabilities, we're not seeing equitable distribution. So I think that is a truly urgent call to action, both nationally and globally.
Eddie, what can you tell us about the launch of your Global Access Fund and the ways in which it's going to address the sort of disparities we're talking about in terms of healthcare access?
The Global Access Fund is an inclusive development financing vehicle envisioned to meet the needs and reflect the aspirations of the more than 1 billion people with disabilities who live on the planet today. Our goal is to mobilize at least $1 billion in additional financing to ensure that we give credence to the idea of leaving nobody behind within the decade of action for delivery of the 2030 Agenda for Sustainable Development. And so, again, if we provide the conditions for people with disabilities to have a life of health and a life of wellness by investing in the healthcare needs of people with disabilities, specifically through the provision of adaptive technology, through the provision of the kind of care infrastructure that so many people with disabilities depend on, then we'll be in a position to ensure that this particular segment of society is not left behind as it pertains to the achievement of the SDGs. And the other thing I would say as well is that I think we need to start doing a better job of connecting the different goals to one another. What COVID-19 has revealed is that we cannot have a conversation about SDG 3 around health in isolation from some of the other goals, like SDG 10 around reducing inequalities, or SDG 4, or SDG 5 for that matter. All of the global goals, from a methodological standpoint, need to be seen as building on one another. So that becomes really important as we think about what the global recovery might look like.
Thank you, Mark Suzman from the Gates Foundation, Eddie Ndopu, SDG advocate, for joining us today in the Global Goals Studio. Thank you.